and author, educationist, and editor of Medicos Journal, published from Maharashtra. Dr. S.N. Hussain ji.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. In the name of Allah, most beneficent and merciful. Dear friends, especially I thank to Dr. S.K. Agarwal to given me this opportunity to speak on Unani system of medicine in this webinar and give some awareness which possible. I am also happy to learn something from Dr. Dr. Gupta and Dr. Pawan Sharma and Dr. Rahman also. Thanks to all. Before giving information on Unani medicines and its effectiveness on COVID-19 disease, I would like to introduce something about Unani system of healing or science, which is 5,000-year-old, and as most of the people, even the doctors, especially allopathic doctors or Ayush doctors, they are less aware about the Unani system of medicine. Something it's related with some community, particular community, something this system is related with a particular nation. But in fact, this system, Unani system of medicine, originated in Sumer civilization about 5,000 years before Christ. And at that time, it was known as Altib only. Actually, there is some fact about that. The Hippocrates, which we say father of our Unani system of medicine, the modern science, allopathic doctors say the father of their modern system of medicine, but in fact, which is accepted by the most of scholars around the world, that Hippocrates is not only the father of Unani system or modern science, it is the father of all alternative medical science. Even the homeopathy, in homeopathy, Dr. Henneman also referred most of the principles and theories from the philosophy of Hippocrates. The similia similibus curinator. This is one of the basic principle in in a homeopathy system, which is in Unani known as ilaj bil misl. It's mean that if you look behind, you will find the way that the Ayurveda, homeopathy, naturopathy, or any alternative, most of the alternative branches are linked with the Unani system. The Hippocrates was the first human who introduces the tib or medical science or Unani medicine and given its status of science. Before Hippocrates, this system was known as magic or superstition. It is the Hippocrates who introduces this science, and now that's why the reason is we all the follower of different pathies call him father of medicine, father of Unani medicine, or father of alternative medicine. If there is a disease, what we believe, if there is a disease, of course there is a medicine also. It is possible that we don't know the exact what to give for this particular disease, but there is a medicine which found on earth, and we have to search it, we have to research it, and after research, prescribe or give to the patients. In Unani system of medicine, the fundamental is based on humoral theory, means the blood of the human being is contain four things: dam, balgam, sauda, and safra. We believe that if there is a difference or there is any imbalance between this any one thing, even the dam, balgam, or safra, there will be disturbance in health, and the person will get some sickness, some discomfort, or some disorders due to changes or imbalance in the humoral of the human being. Especially in COVID-19 treatment, we look the temperament of the patient and temperament of the Unani drug. Actually, misas or temperament is the one of the basic method of diagnosis and treatment, which is having the 100% or majority of the percent of success. The Unani system of medicine having the lots of literatures and time-tested Unani drugs for the some epidemic or pandemic diseases. It is fact that the COVID-19 is now today, it is a new viral disease, but such type of disease already we have in the past. And of course, there are some medicines which are very useful in the symptoms of the COVID-19. If we see the literature of the Unani system, we found that there is some terms used like tadia. Tadia means infection. And if it is mentioned there, then it's mean if someone get infection due to bacteria or any factor, then there are some medicines which will be used to treat and remove that infection. Also, there is a one term used, wabai. Wabai is normally used when pandemic type of situations occur. Like today, we are having the danger situation of the COVID-19. It is the fact that is not clear actually about the virus or a disease. Most of the thing is not clear, but what is clear? The symptoms. The symptoms, what we know are fever, sore throat, cough, or breathlessness. This is the main symptoms on which we treat the patient. But about the virus, if you see the electronic media, print media, or scientific views of some scientists, that they have different views, different suggestions, and different theories, then whatever it may be, but the Unani system or like that other some pathies, homeopathy and other pathy, they use the terms like wabai or tadia, means it covers all the bacterial, viral or parasitic or any type of infection. But what symptoms created after that infection, we have to treat it. We have to treat the cause as well as the symptoms. There are some of the most important factors, and it is this COVID-19, according to the Unani system, this COVID-19 disorder or disease or infection caused to those persons who have cold temperament or those having cold Balgami misas. Second most factor is weak immunity. And it is fact that those having the cold temperament, they are having the weak immunity. Also, those are having some other chronic disorders like diabetes, hypertension, and some other diseases. They are most prone to get COVID-19 infection. And that's why we have to treat the patient according to their symptoms as well as their infections. if you see the symptoms of the COVID-19 patient, except fever, all symptoms are cold. For example, the patient has cough, irritation in throat, breathlessness, common cold, body ache, joint pain. These are the cold symptoms. It means that the patient is cold temperament, or if not, now at present he or she has cold uh, temperament, or there is a changes in his body. If there is a fever, normally we know as a doctor, if there is a fever, it's mean there is an infection. And other symptoms, they indicate that there is some changes in the blood humor or in his body. The precautions what we take or what is advised are in general the modern science, allopathic, homeopathic, or any other system. The most of the precautions are same. If patient has or to prevent this infection, we have to avoid cold things, cold foods, cold water, cold climate, every whatever things which increase the cold cough in your body, we have to avoid such things. And that's why it is better to discuss the treatment and the management part of the Unani system to treat the COVID-19, because the precautionary points or suggestions are common. Like that, as the previous speakers told us or suggested or informed that wear the mask and avoid to in contact with infected persons, avoid to enter such areas for traveling and other things. Uh, so we go to the part of the treatment and management. Most of the people, students, or doctors of other pathy, they think Unani systems are non-vegetarian or having most of medicines they use from the animal parts or animal medicines. But in fact, the Unani drugs at present in India or in the Shark countries, you can say, the 80% of drugs are used herbal, or 5% hardly you can say minerals. Only 15%, 1/5, are used from the animal medicines. That's but this misconception to be removed from the people or the our medical fraternity, that this Unani system is just having the animals medicine only. This is not the fact. We had to remove this. The Unani system and its literature has most of the classical medicines for COVID-19 and such type of disorders from any other virus or bacteria. For example, the number one medicine which used in Unani system is Habbe Marwarid or Khamire Marwarid. Habbe Marwarid is a tablet uh, which can be prescribed one tablet once a day for 3 to 5 days as a precaution or prevention, or for the treatment in case if a person got the infection, then it may be for 15 days we can prescribe. And it has tremendous result to treat the not only the symptoms, the is act as an antiviral and give the help to come up uh, from this disease. The Khamira Marwarid is normally it is a paste. In case if the for the children or under the age of 10 years, we cannot give the tablet. In such cases, we can prescribe Khamira Marwarid. Both are Marwarid, Habbe Marwarid, Khamira Marwarid. Habbe Marwarid is a tablet for adults, and Khamira Marwarid adult may be used, But mostly if we want to give to children, then we will give the Khamire Marwari. Also, there are two more very effective classical Unani medicines. That are Tiryake Arba. Tiryake Arba, you also use as powder or as a paste. You can make in the home also, or it is ready-made available in the market or Ayush medical stores. There is some drops or liquid. It is known as Tiryake Ajib. Tiryake Ajib actually a composition of Satya Pudina, Satya Ajwain, and Satya Kafur. This three combination we in Unani we use as a drops or liquid. Just 5 drops you put in a glass of water, and take a hot steam or bhap. It will help for the nasal congestion, sore throat, and other symptoms uh, instantly. Also, for the knowledge of our students and the doctors, those are interested to know the formulation of the Tiryake Arba powder, just they may note down. There is a 4 medicines, 4 herbs: Habbul Gar, Mur Makki, Pakhan Bed, and Jarawan Tawil, all in equal quantity. Make a powder, and just put 1 spoon 5 gram powder in a glass of water, boil it, and have this water as a tea, like tea, means at a sway. This is very effective, and these are the classical. If you have no time or you want to purchase from the market, you can go and purchase from the Ayush medicals available near you. There are something informed, just our previous speaker, Dr. Uh, Mujibur Rahman Sahib, that in government of Maharashtra approved one Joshanda. Actually, this is the fact. I know our colleagues, because I am belong from Maharashtra, Bombay. There is a one Joshanda developed by some senior Hakim and Unani experts from Mansoura Medical College. There is a one Unani Medical College. The teachers from there, they do hard work and produced a Joshanda, and really a tremendous results we found. Now they are trying to distribute it free of charge or a minimum charges, oh, almost all the part of the Maharashtra. Just government of Maharashtra, even the CM appreciated them and given the assurance to do more for the Unani system in the state. Also, just previous speaker said about the central government given one formulation and introduces Ayush Joshanda. In Unani, it is Ayush Joshanda, which has very simple drugs contents, but having a very effective results. This has tulsi, dalchini, adrak, and filfilsia. This in equal quantity. Just make a powder, very simple formulation, make a powder, and 1 spoon or 5 gram powder, put in a hot water or boil it, and have a just like a tea. And of course, just 3 days for prevention. 3-4 days is very good, and after break you can take every 3 days or every 7 days or every 10 days. If you take daily, of course this is a good for health. There is no side effect, nothing to say or nothing to think there is a side effect of this Unani drugs. Actually, in India we say it is drug, but in fact if we go internationally, it is not the drug, it is the food. That's why if we believe it is a food, then there is no side effect of food, all. And also this Joshanda or these medicines having the result, but at the same time some patients has some symptomatic problems, like some may have the breathlessness, some may have the fever, and some may have the body ache, some may have pain in the different parts of the body. In such situations, if there is a fever, ready-made tablets available, Unani medicines, these are Habbe Bukhar. Very simple to remember name also, Bukhar. Bukhar means fever. Habbe Bukhar, tablet of fever. It is available easily in the market at the Ayush medicals. And if there is a pain, especially nervine type of pain, and if there is a pricking pain, then in such situations, Habbe Asgandh, Asgandh is also a very common name, and it is freely available in the market. Habbe Asgandh, one tablet 3 times you can given up to subside of the symptoms. And Habbe Bukhar is also till the subside of the symptoms you can prescribe. If there is a breathlessness or asthma type of system, there is a difficulty in breathing. In such situations, you can use or prescribe Sharbate Zufa. Sharbate Zufa is the best Unani syrup you can use such patients. And also, if there is irritation, cough, or there is a uh, producing of the cough in the throat, or there is a nasal discharge, in such situation, uh, tooth, sharbate tooth is siyah or sharbate tooth. Any of these are available. You can use 15 ml 3 times once a day up to subside of the symptoms. Also, there is a three most common herbs found in the Unani system. That is a Khaksi, Karanjwa, and Gilo. These medicines has we no need to say this herbs having the antiviral effect. Of course, this having the antiviral, antibacterial effects. Without saying we can give it and we got the 100% result. In most of the cases, not just the COVID-19. In COVID-19, if there is a fever or due to a virus or due to other reason, you just give 5 milligram or 2.5 milligram 2 times or 3 times with honey or shahad, or otherwise just make a paste by water and have it. You will your fever will be subside within a few minutes. These are used. These three, anyone, not this is not necessary to use this composition of the Khaksi, Gilo or Karanjwa. If you use just Karanjwa, just Khaksi, just Gilo, only single Unani herb, your fever will be subside. Then these are the treasure of the uh, from the Unani system to treat the viral, bacterial, or COVID-19 type of disorders, which having the symptoms most common fever and breathlessness or this thing. These medicines are found very effective, and they give the relief uh, to recur, not recur again these symptoms to the patient, and the patient will get benefited and become the healthy, and also immunity will increase, and the immunity is one of the most important thing. This is the self defense system. These medicines, whatever we use as a joshanda or habbe marwarid or khamira marwarid, this is not just to act as an antiviral or antibacterial. It also increases the body immunity of ourselves, and this immunity help to stand on our health and increase our health. I hope these Unani medicines will help to fight with this deadly Corona 19 virus or disease, and we will become the healthy, and we will do routinely whatever our world as before. Thank you. Thank you very much.
Finally, I would like thank you, sir. Thank you, Dr. Hussain ji. We thank you for your key insights on the use of Unani, the management and the prevention of COVID-19. It was very comprehensive speech by you, and we thank you for the same. We hope all the students have made the notes of the points raised by Dr. Hussain ji. Now, I would like to hand over the mic to Dr. Suresh Kumar Agarwal to facilitate a session of panelists to discuss some points, important points on the prevention management of COVID-19 in Ayurvedic homeopathy and Unani way. To Dr. Suresh Kumar Agarwal.
At the very beginning, I would like to thank all the esteemed speakers, Dr. Ahsan Hussain, Dr. Mujibur Rahman, Dr. Pawan Sharma, and Dr. A.K. Gupta, for their very practical suggestions for the prevention and management of COVID-19 by their own systems of medicine, may it be homeopathy, Ayurveda, or Unani. I would now like to request Dr. A.K. Gupta to chair a session of panelists where we would like to have suggestions from all the panelists. And these suggestions will be sent to the Ministry of Ayush on behalf of the Pragyan International University. To begin with, I would like to suggest a few points. The first of all is, instead of social distancing, we should use the word physical distancing, since social distancing and physical distancing, these two things are two different things. In reality, we are physically distant, but socially we are connected, emotionally we are connected. So the word social distancing should be replaced by physical distancing.